Allergy is always a very small section, but pertinent. It's like a tiny, tasty chocolate that's always small and always so nice. Now, the first part that's a must know, and you might say, well, what has changed with anaphylaxis? Well, there is some things that have changed with anaphylaxis. So for instance, making sure that you know the epinephrine is intramuscular. Now this is a difference than in the past. So old editions of our own books would have said subcutaneous. Subcutaneous is pretty good, but intramuscular is gooder. So anaphylaxis, well, what's the difference between just an allergic reaction that's a rash and anaphylaxis? And the answer is low blood pressure and respiratory problems. What's the difference between the allergic reaction? Well, it is respiratory problems. And remember that anything that goes lip, tongue, mouth, face, anything that looks like it's even near the face or the mouth or the tongue counts as anaphylaxis because they're all things that could be impairing people's ability to breathe. So all of these would count as anaphylactic reactions, even if it doesn't say that they're wheezing or short of breath. Even if it doesn't say that, hi, I've got wheezing, or I am dyspneic, or I am shortness of breath, that lip, tongue, and face all still count as anaphylaxis. So let's keep our goals in mind here. I understand that we're studying for a test, and that is true. But you're supposed to be able to take everything we do here, and you're supposed to be able to manage patients with it. So this is not separate from the managing patients. Now, you can't always take what you learn from your attendings and use it for your test. But you're supposed to be able to take what we do for our test and use it to manage patients instantly. So a person comes in and they say, well, you know what? I had penicillin or sulfa drugs. I had peanuts or apricots or chocolate, and I have swelling of my face, my tongue, my lips. The answer is epinephrine intramuscularly, glucocorticoids, IV or oral, antihistamines, not the antihistamines that you use for your own allergic rhinitis, but diphenhydramine, Benadryl, because yes, this massive form of H1 blocker that causes sedation, because it's better to be alive and sedated than be dead but fully awake, something like that. So the point is that epinephrine works instantaneously. How long does it take for steroids to work if you have anaphylaxis? How long does it take steroids to work acutely in anybody? How long does it take steroids to work for asthma? How long does it take for steroids to work in these circumstances? And the answer is steroids take somewhere minimum 4 hours to work. Steroids take 4 to 6 hours to work no matter what the indication is. So steroids have to be given right away because you have to account for the fact that there's going to be a delay in how long they take to be efficacious. Diphenhydramine, hydroxyzine. Diphenhydramine and hydroxyzine, that's how you're going to know it's anaphylaxis. How do you know the difference between a GI bleed and someone who needs to go to the ICU? Hypotension, respiratory. What's the difference between an infection and sepsis? Hypotension, respiratory, chest pain, shortness of breath, hypotension, confusion, chest pain, shortness of breath, hypotension, confusion, means you're not getting enough perfusion. Chest pain, shortness of breath, hypotension, confusion, means you're not getting enough perfusion. Oh, blood pressure and anything that's respiratory, lip, tongue, face, and the answer is epinephrine, steroids, diphenhydramine. There's the anaphylaxis story. Now, how's that different than angioedema? Well, angioedema is someone who also has this happening and they don't itch. They don't tend to have the same degree of hypotension, and it's from very minor trauma. I got hit in the face with a pillow. I had some wood chips smacking me in the arm. I had some very, very, very minor trauma, or I had medications like ACE inhibitors and my face exploded. Now, if it's an allergic form of angioedema, epinephrine and steroids will help. Antihistamines, well, if it's allergic, but if it's hereditary angioneurotic edema, if it's ACE inhibitors from C1 esterase inhibitor deficiency, if it's ACE inhibitors with C1 esterase inhibitor, C1 esterase inhibitor deficiency, then you need some other things. You need things that will block kallikrein, block bradykinin. And I got 2 new things for you today. I got very special for you. 2 new things. We got ecallantide, which is something that will block kallikrein. And we got icatibant, which will block bradykinin receptors. Block bradykinin, block kallikrein. And these are the new things. Now, I'll tell you, the allergy section for what we need to know for our test is short, ladies and gentlemen. It's not a big deal. Not a big deal. It's short. It's a short section. However, you still got 2 big new things here. Ecallantides, a kallikrein receptor antagonist. Icatibant, a bradykinin receptor antagonist. We got 2 big new things here. You see, that's a lot better. You can replace C1 esterase inhibitor. You actually can replace it. We actually have replacement. We actually have replacement for C1 esterase inhibitor. Yes, you have replacement. Or you can use fresh frozen plasma to try and replace it. If minor trauma causing you to have your face swell, tongue swell, your face explodes. Angioedema. Now, when we have a person who's got urticaria, the urticaria acutely is from bugs, insect bites, drugs, medications, foods like chocolate and peanuts and chocolate and peanuts and chocolate and peanuts. Acutely, urticaria is from bugs, drugs, and foods. Bugs, drugs, and foods. Bugs, drugs, and foods, and bugs, drugs, and foods. Insects, medications, and foods like peanuts and chocolate, apricots. Bugs, drugs, and foods. And acutely, antihistamines and steroids. But chronic urticaria is people who have it from pressure on particular parts of your body. Cold urticaria, vibration, pressure, cold, and vibratory senses. So chronic urticaria is from the pressure, cold, vibration, or as I like to say, the pressure of a cold vibrator. Now the pressure of both of these things, this is antihistamines, but the antihistamines here are loratadine, fexofenadine, nizatidine, lefexofenadine. Loratadine, fexofenadine, loratadine, nizatidine. So these are the antihistamines that are useful in long-term chronic anaphylaxis. You see, the antihistamines for anaphylaxis, diphenhydramine, ooh, that's acute, that's sedating. We wouldn't want to use that. That's a sleepy time. A sleepy time. Benadryl. Dry mouth, sleepy. It's so sedating. Loratadine, fexofenadine, cetirizine. These are non-sedating H1 blocker. Remember, non-sedating H1 blocker. This is for urticaria. Okay, urticaria, bugs, drugs, and foods, and chronically the pressure of a cold vibrator. The last thing for this section is allergic rhinitis. Oh, my love is like a melody that's newly sprung in June. My love is like sweetly played in tune. I've got allergic rhinitis. My nose is sneezy and itchy. And I want some topical antihistamines and steroids. Inhaled steroids. Montelukast. This is leukotriene inhibitor. Steroids, oxymetazoline. Steroids, montelukast, a leukotriene inhibitor. Allergic rhinitis, by far the #1 most important thing for allergic rhinitis is inhaled nasal topical, montelukast, oxymetazoline, and calm down your allergic rhinitis while waiting to desensitize you. So what do we have here? How do you know it's anaphylaxis? Hypotension, respiratory. Lip, tongue, face count as respiratory. Angioedema, minor trauma, making your face explode, like C1 esterase inhibitor deficiency. Yes, if there's an allergic component, steroids and epinephrine will work. However, for people it's not allergic, but just C1, hereditary C1 esterase inhibitor deficiency, ecallantine is kallikrein antagonist, icatibant is a bradykinin antagonist. Urticaria acutely is bugs, drugs, and foods. Chronically is the pressure of a cold vibrator. They both get treated with loratadine, fexofenadine, cetirizine, which are H1 blockers. They're not sedating. Over the counter, you know that is Claritin, Allegra, Zyrtec. And allergic rhinitis, of which the number one thing for you to know about is to say, itchy nose, inhaled nasal steroids. Nasacort is over the counter. Remember that. See you in the next section.